Good morning, George. It's the last Tuesday of the year, and we want to wish everybody across the world that listens to the podcast a very prosperous 2025. Thanks for listening to us. Thanks for being our friends. It's been a phenomenal 2024. And today we start with a surprise guest, Dr. Delia Rogul, who's going to wish all of our listeners a very happy new year.
Happy New Year, everybody. I'm wishing you a happy, healthy, prosperous New Year, and I hope everything you wish for comes true.
Thank you.
Nice podcast. Bye-bye.
Happy New Year to you too.
This episode is sponsored by our friends over at Freed AI Medical Scribes. Let's hear what they have to say. What if you could take the computer out of the physician-patient relationship? With Freed, you can. Freed is the AI medical scribe that listens, transcribes, and crafts perfect SOAP notes for you seamlessly. This isn't just another productivity tool. Freed is a life-altering solution for physicians, helping you regain the joy of practicing medicine. Freed frees you from the burden of documentation, so you can focus on what really matters, your patients. With Freed, the computer is no longer a barrier. It's a quiet assistant that works in the background, capturing every word of your patient interactions, accurately and quickly. The result, you're fully present in each visit, building stronger connections and offering more attentive care. And when the day is done, your notes are too, leaving you with more time to focus on yourself, your family, and your life outside of medicine. Freed is the solution thousands of physicians swear by to reclaim their passion for medicine.
So today we have some fabulous guests, all my partners from Reisman, Brown, and Kaplan, the transformation of RBK Pediatrics. And our topic today is going to be 66 years of pediatric care. We want to tell the story of the evolution of Reisman, Brown, and Kaplan into RBK Pediatrics and urgent care with the merger with Dr. Hafiz Raymond's practice into RBK Pediatrics. Unfortunately, the original practice of Dr. Barlizo is no longer with us, so we'll just think he's here with us. So take it away, Herb.
Welcome, everybody. Dr. Kaplan, it's a pleasure to have you. You're the most senior of the partners. And our listeners are really interested in knowing what was RBK when you were there.
RBK started out actually 62 years ago. Reisman's house. He transformed his lowest level of the house and to the office. And then in about 67 or 68, he took on Bob Brown as an associate and then became a partner. And then in 69, they took in a third pediatrician. They took in a third associate in around 69 and then split. They had opened up a Brentwood office and they gave him the Brentwood office. And I joined in 71, still working out of the Reisman's house, basically, which limited us to a certain extent because on Sundays and office hours, we had to be quiet when the kids came in because it was right below their bedroom area. And then about 2 years later, we opened up the other office on Comac Road. Reisman was making regular trips to the city to buy the property from a woman who owned that piece of land. And that was about 73. And there we were until eventually Neil joined us. And then everything went downhill when Rogul came in.
You have to tell us why in the world, that darn parking lot, how we survived all these years with that hill. Why in the world you guys buy a building with a parking lot that was so god-awful? We must have lost lots of patients because of that.
That was a disaster, but that was the only property that was really for sale that Reisman could go ahead and get at a reasonable price. Everything you did there was very difficult. Putting up a traffic light, we couldn't get the water line. We had to fight until we contacted a legislator in Smithtown who turned us from the well water into town water. Each thing was a real hurdle to go ahead and do. But the parking lot was a parking lot.
Dr. Kaplan, what was the biggest change that you saw at RBK?
Through the years?
Yes.
Insurance.
How so?
It was interesting. When I came into practice, nobody was really managing the outstanding balances. and there were a lot of outstanding balances. We had one patient who would come in, the mom would come in for her allergy shots. She knew Reisman. Reisman would come in for allergy shots. She'd pull up in her Bentley, park the car, and never paid bills. Never paid bills. I wound up taking over all the finances as far as collecting the money there, and started charging interest rates on those outstanding bills if they weren't going to pay. And eventually the insurance came in, and what can I say at this point? Everyone went to insurance. It was few people left that had the private pay.
I guess they used to pay in chickens when they couldn't pay in cash.
We got cakes, we got all other things.
What do you think was the glue that has held RBK together through several generations of pediatricians and even more generations of children, right?
It's a good question. I think it's good medicine. The physicians all practice good medicine, and the love of the children being there. I think really what it is. I'm still in contact with a couple of patients. One every year at time of his birthday, we send cards to each other. And this year I was in contact with one young lady who I didn't realize is 44 years old already. And so it's just that constant contact. Where I am in Florida right now, must have about a half a dozen families that were patients of ours. Their kids were patients of ours. So it's that ongoing community effect. And Reisman honestly was very involved in the community. And he brought in a lot of patients that way.
I think it was like our availability. There was night hours, like when I started, 87, and everyone was there on a Sunday and weekends. So I think the patients appreciated that, and I think that helped.
Yes.
I guess it's all the availability on Sundays and Saturdays and having your physicians on call during the weekends that basically that outshined the lack of the parking lot that we had, because I'm sure we lost a lot of patients because of the dumb parking lot, but the good medical care is probably what made it okay, even with the parking lot.
And Dr. Kaplan, looking back now that you're retired in Florida, what do you think your legacy was at RBK? Because it can't be George Rogel running the place.
I have no idea. I really don't know. Just the social commitment. I was there.
Yeah. People still, Dr. Kaplan, people speak about Dr. Reisman. Dr. Reisman has his wall of fame in the Bayshore office to commemorate his office and his contribution to RBK Pediatrics.
Came in,
amazing.
he was our intern when I started.
It's amazing that a business has survived so many years and so many changes. That I wasn't around when you started, but I know when I started, the accounting was in pegboards, and people paid you mostly in checks or cash. None of these fancy computers and credit cards and all of these new things. And yet the business has evolved and survived. And it's amazing that you started seeing kids on Sunday so far back. That's not seen very often.
It was and still is a 365-day practice.
Correct.
The Dr.
Kaplan,
Kaplan and Dr. Reisman's groups like cross cover each other. Neil told us about that.
excuse me, George?
Is cross cover each other, Neil?
I thought like before I started, like on the Jewish holidays, Dr. Reisman would see your patients that, needed to be seen, that type of thing.
So that's how the smaller groups operated back then.
What happened going back, the way Reisman took in Brown was that it was during a winter holiday that Reisman was signed out to one of the other covering pediatrician in Comac. And then he got a call. The other pediatrician did not want to see any more of his patients. So Reisman had to come back from his vacation, and that's when he took Brown in.
Oh, okay.
Just the coverage.
Dr. Bellerman, what was RBK when you started there?
I joined in 1987, so it was around 15 years after Dr. Kaplan joined. And so it was a little difficult because the patients were used to a certain way with the three of them. And so it was a little hard for me to get a foothold at first, just had to work hard. But basically, like I say, the practice was very available. They prided themselves on not charging as much for office visit as some of the other places, and that we didn't have an OB feeding us because we're stationed in the middle of Long Island. The hospitals are in the north and the south, and the OBs are usually near the hospital. So we just the practice was built by word of mouth, and we would get newborns from our second babies and family and friends and things like that. And so, it was built up. And like we were talking before, Dr. Brown used to say that the practice is the goose that laid the golden egg. So the goose is what's important, the practice, not like one person. Well, no, the practice is there. Practice good medicine, you'll thrive. That's what I was told. And that we took Medicaid, which a lot of places did not. Like no doctor in Huntington took Medicaid, which is, I'm sure, a stark law violation. Like they all got together. And so we would have a lot of Medicaid patients, and that was certainly fine with me, that we took care of those patients that couldn't afford to pay the bills. That's how I was brought in and was very happy the way things were running.
And what was the biggest change you saw as things evolved from the 80s to today?
I think, like Dr. Kaplan said, is the insurance. And like I said, like now no one would say, what do you charge for a visit? It's meaningless. But then it was important what people charge for a visit. You know what, Dr. Kaplan, I'm thinking back, there were some people that had insurance where they would pay us and then get reimbursed, and people would actually get the reimbursement and not pay us. Like there was stuff like that going on. And that irritated me to no end, but that was how it was. And so in some ways things are much simpler. As complicated as insurance is, you don't have to worry about going after every nickel and dime from people. You just deal with the insurance companies. As difficult as that is, in some ways it's better.
Well, and it seems like you think that access, taking care of everybody, being available and practicing good medicine is the glue that held you all together.
Yes, I think so. And it's unfortunate now we try, when we hire people, nobody wants to work Saturdays, but I never questioned it. I probably worked my first year, worked just about every Saturday. And then gradually I would get Saturdays off. And I knew it was important. Like it was very busy on Saturdays. People came in for babies. Dad stays home, mom brings the baby, and vice versa. And kids got sick on the weekends, and we were there.
Saturday is the busiest day of the week for everybody. And if you look at it from the financial point of view, it's the biggest income generator. So why not? Take off on Tuesday. Done.
And so what do you think is your legacy? You're still part of it, but you're not as involved as you used to be.
No, I don't know about legacy. We all tried hard, but like now I enjoyed just yesterday, I saw a 6-month-old baby and the mother came to us and she called me Dr. B. Like a new patient, I wouldn't call me Dr. B. So relationship there, and it just makes things much smoother and nicer. I enjoyed that. We just all try to work hard and keep it moving along.
And when you came into it, do you think that the beast, the goose would last 60, 70 years?
Yeah, I was certainly hoping so. I was young, but no, I can see we all worked hard. We did what we had to do to keep things going. So no, I always looked at other practices. A lot of pediatric patients on Long Island, there's not a shortage of kids. So I knew if we just worked hard, like Dr. Brown said, and took care of the practice, we would thrive. I always felt it.
I know Neil used to say all the time, and Dr. Kaplan, the practice is better than any one physician. And I think that's the glue.
Yeah. That is a very...
Spill that onto everybody else, onto Jim, onto Nick, to Scott, so they don't get crazy on me.
Yeah, it's like a kibbutz mentality, right? It's the community is more important than the individual, which is not seen a lot in our modern day. Everybody cares about themselves and not about the community as much. And Dr. Reisman, you came in later and brought all your beautiful patients to the RBK.
Interestingly, my first encounter with Dr. Reisman, Dr. Brown, Dr. Kaplan was when I joined residency at Good Samaritan Hospital. That was in 1970, and was very friendly with them. They were the attendings. I was the resident. And then, of course, after graduating, finishing the residency, I joined Dr. Grello for 5 years and then started my own practice. And when time came to retire, George Ragu was great. He said, come and join us. We'll take your practice over. We had a great talk, and that's how it started with RBK. I never knew that RBK had an office in Brentwood.
We did.
Yeah, that I didn't know. I knew the Comac office. But
One year.
And
we are in Brentwood wrote that.
that was Dr. Platnick's office, right, Dr.
Oh, Dr. Platnick's office.
Yes, but
Okay.
Reisman and Brown did not have a mutual relationship with Bruce.
But I had a great time during residency dealing with Mike especially, and also with Reisman and Brown. With Reisman, the only problem at that time was his handwriting. I had to run after him every time and say, what have you written? We didn't have computers then. They were all handwritten charts. So he would read it out and the nurses would be happy. Hey, you got that out of him. What a nice man.
Interesting thing, Scott, you don't know this story, but how Dr. Raymond and I decided to make the Dr. Raymond chapter of RBK was one day I get a instant message on Facebook from Dr. Raymond. Hey, I'm looking to retire. I got this computer stuff that's giving me a headache. You guys interested in merging? From Facebook Messenger. You don't remember that, Dr. Raymond?
Yeah, I don't remember that.
That's how it started. And then we met with Neil and Jim, I think. I don't remember exactly who it was that was there. We went to that diner down the street.
Right.
Yes.
And, you know, what I remember of Dr. Raymond's practice joining us was, you know, the computers. We had to bring in the computers to his office. It was going to give him a headache. He didn't like computers, as Dr. Kaplan didn't like computers. And
But once I got used to it, then I said, how did we ever do without it?
I know. And we had those scribes that all typed for you, and he danced around and he did your Dr. Raymond thing. But I think the most important thing that we learned from Dr. Raymond was, and he taught me, how to be a physician, which is a concept that a lot of the people in the younger generation don't know. I don't know if it's a learned behavior or it's a natural behavior, but how to become a physician.
Yeah.
Really important.
The compassionate care, I call it.
No,
And that's the key to my success.
that's pretty good. So I think that's why we have the whole wall dedicated. And we still have your patients, Dr. Raymond.
Oh, yeah. They're
know who
all
they are.
still.
I know who they are. I take them over to the wall and they remember all those pictures that you had on the wall of them that we now transferred into those frames in the office. It's the Dr. Raymond Wall of Fame. I think it's
I cannot walk through Bayshore, go to any restaurant or any Stop and Shop or anywhere without running into my old patients. And they said, we enjoy going to RBK. We're really happy there, but you should come back. And my days are done in my because of medical reasons, as you all know.
yeah. All right.
And you, George, what was the Deuce like when you joined? You were the first foreign medical graduate that joined. You going out there because you wanted to have a pool in the backyard.
Yeah. I remember when I interviewed with Neil, he said, why do you want to come to Long Island? I said, I'm a city kid. All I want is to have grass and a pool. And I think they hired me for that. I was the only one. I was the first one that was non-Air Force. And that's pretty good. And I thought it was great. The walls were horrible. Remember the white paneling that was there? And the sinks that you look like you bought from Home Depot, which they probably did, in the small examination rooms. But I looked at the walls of charts and I looked at the patients and the staff. They were all over the place. Even though they had no computers, they had no nothing. I said, this place has potential. I had to choose. If you guys remember back in the day when I was coming over and my wife was coming over to Long Island, she used to work for that small shop in Huntington. What was it, Schrager and Gordon?
Right.
And go there, take that over, stay here with the group that's probably safer. I didn't have enough practice management knowledge at that point to do it. But we probably should have taken that practice over, Dr. Kaplan, when I told you back in 97. But anyway, it's okay. It worked out good.
But when you got there, they had computers for billing, George?
Zero possibility of that. They had 4 computers. I remember they had a floppy disk that they used to move around from the station to update their files. They had these things that were like ledgers that would handwrite their billing. And those cabinets now live in my garage for 20 years. And in the day before I started working, these guys, they called me up and said, "You're the young guy. Why don't you go find us a computer system to help?" What did I know?
So let me interject. Bob Brown's wife,
Yes, shut up.
Judy, she built out a computer system.
Yes.
All right. And she established the whole setup that we continue with for a number of years until we got to PCC.
It was something, I think it was a homemade database of some sort, but it wasn't network. It was floppy disk that would go from desk to desk and probably potential lots of errors, but it worked. It just worked. So the next generation was when they said, go find the system. You really do. You don't know what you're doing. You search. It was Lycos back then, and Physicians Computer Company, PCC, popped up. They sent over some nice brochures and a laptop to demo. And back then the computers were really expensive. I think they were about $6,000 a computer station. So you guys were working off of those monochrome dumb units, like in the banks.
The Unix.
Yeah, Unix. And I remember the bill, Mike. It was like $30,000 for computer light up and software and everything done and wiring. From paper billing to electronic scheduling, no more of those big appointment books. Everybody kicked and screamed along the way, but it was the right decision.
I'm just curious because remember, a lot of our audience is younger than we are. What did the appointments book look like, and what did you write? What tool did you use to write in the appointments with?
Our office manager had this book, but it wasn't like legal paper. It was like this big, and you would write on, Thursday, 12 o'clock, and there would be 3 slots, depending how many doctors. And it would maybe say, want to see Dr. Reisman, want to see Dr. Brandt. And it was never with the doctor. You would just put a little asterisk, like, if possible to see that doctor. And it was, it's still good. It can work because you could just handwrite in little notes that help, which is sometimes hard to do with the new systems. And it was just very cumbersome.
And it was written in pencil.
Pencil.
Because when somebody canceled an appointment, you would erase it and open that slot for the next person.
Right.
So everything was done in pencil.
Yeah.
And they had an eraser next to the desk.
Yeah.
Erase appointments that failed, right? Folks that didn't live through that don't understand. It looked, I don't know, I wouldn't even say like a Bible because it was wide. And it had 365 days in it, so it was huge. And they would just flip these pages, write it in pencil, and if you cancel your appointment, they would erase it. And only one person could schedule at the time because there's only one book.
That's
right. So you couldn't have 3 schedulers. Only one person could schedule at a time. Otherwise, the whole system broke down.
Right. Hand it off to each other.
Yeah, it's for the younger pediatricians, it was such a different world. I think all of us, maybe except for Scott and Nick, we used maps when we were driving around the country, not GPS. And it's basically the same feeling, right? You had these huge maps you carried in your car and you opened it and then I'm going from DC to Long Island. I got to take Route 95 up to this point, get off at here. And now it's all computers. It's all very different.
okay. It worked.
It worked.
Letters, it worked. Who knows what the future is going to hold?
Yeah, I would replace all of us.
Keep going.
We still got to where we needed to go.
Yeah.
Even with those maps.
Yeah. Yeah. And then I think Dr. Jim Riley came next, right?
Believe so.
Yes, he did.
And
I got taunted by Dr. Okafu, and he brought me to his office with the white paneling, the huge hill, and I had other offers. They were going to give me Mercedes-Benz to work for them. But those offices didn't have George, who I knew at least I would have one person, reliable, good character. So that's how I joined.
Yeah.
No.
I told him, did you ever watch the movie The Firm with Tom Cruise? Yeah, that was not good.
Did they really offer you a Mercedes at a practice in Manhattan?
It was so it was like the upper part of Manhattan, kind of. So I was just like, this would be great. And their office is all brand new and all this kind of stuff. But I was lured.
Yeah, but this is not we're around.
I think we offered you a 56 Chevy, as we recall. No.
I don't know if it's still true, but back in the 80s in Manhattan, if you were a doctor, you had a special license plate and you could park your car wherever the heck you wanted. In front of a fire hydrant, you wouldn't get a ticket. You could drive it on the sidewalk and park it. You wouldn't get a ticket. I thought that was the coolest thing when I was still not a doctor, but I was in medical school and I saw these MD cars parked wherever they wanted.
Yeah, that doesn't
It's
work.
like, that is such a cool thing. But I don't think, is that still true in Manhattan or is that gone?
No, it's replaced with handicap slips.
Yeah.
Yes. Right.
Yeah, so I guess we coasted with Jim for a while.
I want to know from Jim, what was the biggest difference that he's seen since he
I guess the two things are when we opened Bayshore, and as medicine has changed, it used to be in the beginning that the patient would be like, I would call them a Kaplanophile, right? They would only want to see Dr. Kaplan. If I had a day off, they would, even if they were sick, they would wait till I came in the next day. Now, I think the insurance has changed it where patients see us interchangeable. And perhaps that's one of the reasons why all the kids are just so sick. They're much, much more sick nowadays than they were in my day, right? When I first started, if they had ear infection, that was like a lot of the visits. But now a lot of the visits for these adult type diseases, obesity and PCOS and all this kind of stuff, autism, it's terrible.
And you saw the opening of the Bayshore office, right? That was open after you joined.
Yep.
And I think that was probably pretty big.
And that was Dr. Barlizzo's practice that we took over that's no longer with us. Dr. Barlizzo passed away many years ago.
I think what Jim is alluding to really is like the Northwell and Stony Brookification of everything, where you go to Northwell, it was Reisman and Kaplan, it was Dr. Grello, it was Dr. Raymond. The practice had the name of the doctor. Now it's Northwell at Plainview, Stony Brook here. So that's what the people are used to now. Yeah, it certainly changed.
Yeah. Now it's, I could see Dr. Riley at 2, or I can, while I'm driving past one of the 8 urgent cares, I could just see them at 12:30. I'll just stop there because Dr. Riley's a doc. The urgent care doctors are doctors. So what's the difference? You know what I mean? It used to be, like I would go on vacation and the nurses would joke. I would go on vacation and there would be no well babies because all babies would come to see me. And then when I came back, it was all of a sudden be baby, right? And it's not like that anymore.
Yeah, but at least now they're coming to see one of the team doctors at RBK Pediatrics.
Yeah. What better for me?
Because the culture is the same. The ideas are the same. The ideology is the same. The workflows are the same. It was created from way back. The ideas are just put into a computer now.
Mm-hmm.
You know?
And I hear every one of you who's been a partner there say the same thing. The quality of medicine comes first. And the availability to the patient and that shared work ethic is what keeps it all together.
I agree. The shared work ethic.
You have to understand, Reisman did one very smart thing. When he opened up his office, it was in the middle of a new community. And that established patients right away. And that's where the name became part of the community in Comac and just expanded. And then his involvement in the various organizations he was in. And that spread for all of us.
Mm-hmm.
Yeah. I don't know how you carry that forward, although I see some practices that are new that are doing the same thing. High quality, open 7 days a week. Really enjoy seeing the kids. But a lot of these younger physicians want shift work.
Yes.
They want shift work. They don't see them. They don't see, I think to me, being a doctor is like being a rabbi or a priest. You just you go home, but you're still a rabbi or a priest, no matter what the day of the week it is. Someone calls their loved ones in the hospital, you get dressed, you go counsel them. And to me, that's being a doctor is the same thing. Someone calls on Sunday and they need your help. You pick up the phone and you do what you can. I don't think this younger generation has that feeling of community and working together. It's more about me. And I do my shift work and then don't bother me when I get home.
It's the whole hospitalist thing, which is a new special, quote unquote, specialty. It's hard for us to compete. They spend 3 years in the hospital. Then they get, what are you most comfortable doing? Seeing ear infections and Jim said autism, or staying in the hospital. So they stay in the hospital. And like you said, do the shift work. So it's hard for us to find new people to do what we want to do.
I think that mentality on lack of mentorism, because if you hear in all the conversation, everybody instilled how to be a doctor into the next generation. And a lot of these hospital people, they go home at 5. So we're trying to change it at the medical student level. And we have the students in the office, and I think we're growing them. At least I try.
No, it's true. We provide a service that people just can't go to the next street corner and get. So it's true what Herb said is we have to always be there for everybody in order to be reliable for everybody.
And that's a conversation that we have to put out to the new kids on the block. And you, Scott, you got to push that down to them, because they look at me, they're scared of me.
And then Nick joined the practice. What did it look like when you got there?
I joined in 2004, and they just opened the Bayshore location 1 year prior. When I came on board, they had the PCC computerized billing, but it wasn't until 2008 that they went over to the electronic health record, the first one that we started in Countercurrent. So I spent a few years on the paper charts, and I remember we had to look at who was working at each office location. And if I was scheduled to work in the other location, they would give me the charts from the patient that I would have to bring back there to the other location if they were to see me there, because now we had a satellite office. And then I would have to bring it back to the Colmac office so that he can live on the wall.
Yeah.
I remember that.
You try to not do too much of that because it was a pain in the neck. So we used to force the people to pick an office. And that's this.
Look. And it was an exception to the rule to switch locations because it was quite tedious. But we saw that's what they wanted. So we came to accommodate that over time. And then once we implemented electronic health record, then the paper chart was no more. So the chart followed you wherever the computer was. So that should be more accessible for the patients and for us.
Interesting thing, Nick, if you think back, we had the electronic health record for a while before we started to allow the cross-pollination. And why did that happen, Neil? Why did we not allow them even with the computers? Because it was always done this way.
Why? No, but it was very cumbersome when it first started, because we put 6 visits on a sheet of paper, 3 on each side. And someone came to Colmac that was a Bayshore patient. You'd have 1 visit. It would go back, but it would end up in the chart. You'd have 3 or 4 of these 1-visit sheets. So it was hard to follow it chronologically. So it really was not great record keeping. That's what the EMRs is perfect for that.
Yeah.
That's what I also recall. I had an interest in developmental pediatric medicine and behavioral health. So I went and I did a little mini fellowship training in that area. And then I started to work on seeing those patients rather than referring all of them out. And once that happened for me, I started to see more of those patients come from areas outside of our practice and word of mouth. I think at this point, I see a lot of that spilling over into other doctors in our group who have an interest in that and who have an ability to cater to the specialized needs of this patient population, behavioral health, and the chronic conditions in our area.
So now Nick became medical director of the behavioral health program. And he does general peds too. So it's not to do what you want. You just have to develop it and think it.
Right. Standardizing the process, keeping good workflow is important because we have so many moving parts here. I mean, you have the staffing to what you're doing. You have to make sure that no one else is left running on a shorter schedule because these patients take more time.
Yeah.
And someone else has to pick up the slack on the other end. When it's available on the schedule, we try to carve out these days, these constant days, especially for Dr. Riley and myself. That's very important to get these patients in because they do, like Dr. Riley said, they're presenting with these conditions that the adults used to have. We never really used to see that. And now we're seeing 10-year-olds and the PCOS kids and anxiety and depression and autism on the rise in our patient population. It's a lot. It's not just general pediatrics anymore.
Yeah. So you guys developed the chronic care program.
And both of us are doing it today. So it's not like there's a shortage. There's a ton of those patients.
But there's a lot of others that are still learning and they're good at the general peds and the acute care. And so there's other people to pick up where you guys are not, which is good.
Absolutely.
So it's very interesting to me. None of you have mentioned things that I've seen change through my practice, right? So I was an intern in 1989, and that year booted all of the practices out of the lab business. Before that, you didn't have to have a clear certificate. And the clinic where I was an intern at in Michigan, the pediatricians did their own UAs. They looked under the microscope. They did urine cultures in the office. They had a kit for tinea. They would scrape it and they would put it in an incubator, and they would see, depending on the color of the kid, whether the kid had fungus or not. They didn't have a CBC machine. And that I remember, we didn't have RSV, strep, or COVID rapid testing available to us. We did have rapid streps.
Yeah.
And then that's all changed. You can't to have a microscope to look at the urine, you have to have a level 3 CLIA certification. And that's expensive and cumbersome. At least in Northern Virginia, most practices don't do any backup throat cultures or urine cultures in the office or CBCs because it's a moderate complexity lab and it makes it so much difficult.
Dr. Kaplan used to take care of the CLIA. And then when I became a partner, he wanted to pass that torch over to me. And I quickly bypassed that. He said, I think Dr. Riley would be a better fit for that. So Jim has been doing the CLIA stuff for many years, and it's about organization, Jim.
Yeah. And I was very happy to share that with Dr. Scott afterward, right?
And when you give him a nice package and protocols, and all he has to do is follow.
Exactly.
We're trying to make things better. I think
it's changed a lot, George. Now you can have a PCR machine. Who would have really thought that at an office you could be doing PCR testing for viral particles and for chlamydia and for gonorrhea? That just wasn't available even 5 years ago.
And now it is.
So things have evolved so much. And the number of vaccines that we give, that has evolved so much.
What's the question? The impact of all the supermarkets giving out the vaccine, what impact has that had on the practice?
0.
Really?
Yeah. Still come to us for shots, flu shots. You'll lose a handful, but who cares?
Yeah.
It's fistful over there. But
I think that's the beauty of the legacy that you left here too, is people still prefer to come to us for something like a vaccine that they could go to the supermarket for, that they could go to CVS for, but they still prefer to make the appointment and wait and come to us and sit in the waiting room and all of that just for RBK.
Yeah. So I think with everything that we're hearing, Herb, good quality care, provide service, provide access, provide everything in one-stop shop for everything, put it into a nice, pretty package with good physicians is what gave me the opportunity to now go to insurance companies and not accept what they give you and negotiate.
Yeah.
And sustain us, can keep us going forward because we're different than your regular doc in the box.
And Nick, what do you think? What do you want your legacy to be at RBK? And what do you need to do to make that happen?
Obviously, I would think it's a mix. It's the work ethic for sure. It's the commitment to our patients. It's a commitment to our coworkers, our staff. It's more like a family rather than just a place to work. And that's why we continue to have our holiday festivities, and we treat it like a family gathering. So it's nice. We're trying to find different things to do to keep it interesting. We try to expand our horizons. We developed the urgent care model a few years ago at RBK, and I think that really set our trajectory to the next level. But also on the personal side, family is very important, and it's hard to find that balance. So it takes a lot of sacrifice, don't get me wrong. And everyone has put a lot of work into RBK Pediatrics at the sacrifice of something at the family level. So it's good that we had that family support, our own family support, to help us give our best here, but having a good support system on the other side to balance it out. I think it's that part too that sometimes we don't talk about too much.
I think is we have a lot of docs and we instill the culture into them to step up when needed. We had the emergency on Saturday. I couldn't come in. Neil stepped up, and Neil's on retirement.
Have a 5-day weekend.
And it was a holiday weekend. He didn't say, I'm sorry. He just did. That's the culture we're trying to instill in these doctors to just step up, because one day you're going to ask for somebody to step up for you.
It goes back to the old saying, treat others like you want yourself to be treated. So put yourself in that situation. Next time, be that other individual that you need to step in for. Hopefully we can paint that picture and they can see that there's a benefit to it.
Now with all the EHRs and population health and value-based contracts, we're super computerized in everything. We have telemedicine. We're doing telemedicine yesterday I did the first time where one doctor did just telemedicine. I was full. I was just as full as if I was in the office, and I literally was in the call center. And that helps to be in the call center and talk to the staff if needed. If you put a doctor in, he just fills up. It's amazing.
So Scott, what is RBK today? You're the youngest partner. So how did you find it today?
Yeah, so when I joined, all of this was already established. You'd already set the practice. You'd already defined your legacies, basically, like the theme of everything we've been talking about. We were open all of the time. We were always available. We had great relationships with your patients. That was already established when I joined. Right after I joined is when things like the pandemic started. And so the theme of RBK for me is how quickly we're able to adapt and evolve to all of the changes that are happening now. We went from a brand new pandemic to a brand new test, to brand new vaccines.
A brand new office.
To brand new offices. We were talking about all the new technology and everything. So for me, the thing about RBK is how fast we're able to just assimilate this stuff into how we do things and improve our care rapidly for the patients every time these new things come out. I think that's the most impressive thing about RBK to me, is just how we grow and evolve with everything that's going on around us that we have no control over. And the only thing we can control is the care that we give to our patients. And I'm very impressed with how quickly we're able to grow that and help our patients out like that.
I used to say it used to be the RBK Titanic because it was a very good ship, but very hard to maneuver and to adapt and to change. And then through the pandemic, it became the RBK Enterprise. And we will not be assimilated by the Borg. That's a guarantee. Right?
Yeah, and our patients appreciate that. I think they definitely recognize that about us. And that's why they love coming to us so much, is they feel like they're getting good personal care, modern medicine, good medicine. They recognize that our doctors all work as a team together, that when they go see another person, they're not going to see another doctor in isolation. We're always in communication with each other. Everybody knows each other. It's a good environment to come to and feel safe in, I think, for the patients.
Dr. Raymond, your presence was not assimilated by the board, merged with the enterprise. What do you think we did? Do you think we did a good job?
You did a great job. You did a great job. My patients, whom I still run into, as I said, are very happy with that. They still say, hey, come back one day. But I said, no, you got good doctors there, and they're very happy. Again, it's the care, number one, the availability, number two. And when I was single, I would still go every single Sunday if I was in town for 1 hour. That would save me a lot of problems on Monday morning. And you guys have done a better job than that.
Yeah, there's more of us. And then also the technology is important, but it's not the most important. And I think that's where the hospitals and the systems lose it. They think that they can throw technology and some entity in front of a computer and to be Dr. Raymond, to be Dr. Kaplan. It's impossible. It's impossible for them to do that. They cannot be Dr. Raymond and Dr. Kaplan. That comes first. The computer comes second. Do you agree with that, guys?
Yeah, 100%.
Yeah.
I had done even circumcisions in the office, believe it or not. And a lot of us don't even do that in the hospital now because the OBs want all of that. But that's the kind of care we were able to give.
Yeah. Active Simon.
And then, did Scott go away? So how are you going to carry this legacy forth, Scott? Because you're the youngest partner.
Yeah, it's basically just training up the younger generation and showing them how we do things and why we do things the way that we do things. And that's the most important thing is we're here for the patients. We're not here for ourselves. And so everything that we've done up until this point, be open all the time, be accessible, be good, all of that's designed for the patients. And so we have to teach the next generation of doctors why they're doing all of this. And I think that's the most important way to do it.
Yeah, the mentoring. And we're doing that through, I got tired of getting headhunters bringing you doctors that stay for a year and leave. So we have with the NYIT Medical School, we have third years and fourth year medical students rotate through the office. So we're growing them. I got one that went into peds. He just started. He's probably going to come back in a couple of years. And these are all Long Island kids. They want to stay on Long Island. My current student, she's from Manorville. Her whole family's here. She wants to do peds. I didn't convince her, but she loved working at the office. I asked her, do you think I work a lot? She says, not really. And I probably work a lot in some people's eyes. So I think we got to grow them through the school system. And if you make your own little farm, you plant your seed today, it'll grow tomorrow. Even with Dr. Nick. We got Dr. Barlizo's office because 2 years before Nick graduated, I said, hey, Dr. Barlizo, do you know anybody who's looking for a job? Because my little brother is going to be looking for a job one day. 2 years later, he calls, I want to push the practice to you guys. I heard your brother's still working. You got to plant the seed today for it to sprout tomorrow.
Gentlemen, it's really been an honor and a pleasure to get to meet all of you in different ways. And it's really been a joy to see how RBK works throughout the last 2 years. I want to wish you all the best of health in 2025. And I hope that we can all get together in the real world one day.
Yeah.
Thank you for your time today.
Thank you.
Happy New Year.
Everybody.
Happy New Year to everybody.
Thank you for having us.
Nice seeing you.
Mike.
Seeing all of you at one time.
Yeah, we haven't done a meeting like this in many years. We used to do them in person. It used to last forever. I was telling Neil.
Be well.